So I'm Adam Atherly. I'm the chair of Health Systems Management Policy, and so I think my task is to give a research overview of our department. I was teaching this morning, so I missed most of my colleagues' presentations, so I have no idea what they did, but mine's probably different since we didn't get a lot of instruction. And when I put these slides together, my slide, if there's any students here, if you ever put a slide group together like I did, I'll just kill you on grading because the slides just have way, way, way too many words. But I'm not being graded, so I felt okay about it. But to reward you for the fact that I've put up these terrible slides, I'm going to tell you a secret at the end of my talk. So this is a timeline. So EPI can't do this or biostats, but one of the nice things about being the chair of a new department is I was able to put in, I can talk about a timeline. So the Colorado School of Public Health was established in July 2008, and then I was hired in November of that same year. So for the first, I guess, 4 or 5 months, Dick Hammond, who was here for a while, was the acting. There's Dick. So Dick was the chair of HSMP until he hired me and managed to offload the job. And so when I came, there was Dick as the chair, and then Cindy Bryant was the concentration director. And so it was Cindy and I. And so we started a recruitment because there was some hope that the School of Public Health would get accredited, and this was a necessary department for that accreditation. And so we got busy recruiting people, and so a couple of things happened. You'll notice there's Kathy Battaglia here, she's a nurse with a PhD in health services research, and she's the head of the health services research PhD program, which came into the department, and her appointment was effective in January of 2009. And then we did a national recruitment, and we've always done really, really well on our national recruitment. So the first time we did our recruitment, we were able to recruit Hai Fang, who was at the Health Services Research Group at the University of Miami and had a very nice track record of research. And he started in June 1st of 2009. And then Rich Lindruth, who's going to be speaking later on, he was at the Medical University of South Carolina. And Rich is really well known nationally, and I thought it was going to be kind of a long shot to get him to come here. He had lots of competing offers, and I thought, wow, do we have a really shot? So I was talking to him, and he said, oh yeah, my dog's named Copper. And I thought, like coppers and rubbers? And he said, no, like Copper Mountain, my favorite place to ski. And I thought, oh, we're talking. And then Elaine Murado, who is already here in the School of Medicine, then moved her appointment from the School of Medicine into HSMP. Terry Batliner is a physician, and he used to head the VA system in this region as well. He's over in Cayenne, and he moved his appointment over in March. And then in September 2010, Angela Sawaya, who's the first graduate of the EPI PhD program at this school and is also a physician, came over into the department. And then that's about the point that we reached accreditation. And then we did one more job search, and we hired Jenny Pham Cantner, who's an economist. She got her PhD at the University of Chicago and did her postdoc at Princeton. And then, so she came, and then Beth McManus, who you're going to hear from very quickly, came, and she got her PhD in developmental epi from Harvard and then did a postdoc at the University of Wisconsin. And she not only has a PhD, she's also a physical therapist. She does pediatric physical therapy and still practices clinically to this day. And then the last member of our department was Greg Tung, who came from Johns Hopkins and was hired as a member of Piper in January of this year. And so that's essentially our department. So there's 8 people. We don't have any full professors in our department at all. We've got 4 associate professors and then, 5 associate professors and then 3 assistant professors. So we're a young department both in terms of the age of the faculty and also just in the reality of we've only existed for 5 years. We're sort of more recent than the school. When we think about putting a department like this, really what we were trying to do is put together a health services research department. And really what we are good at is research methodology. And so our strength is in health services research methods. So I've sort of listed a whole bunch of things like we do here, like analysis of observational data. We have a lot of good econometricians. We have people who do lots of comparative effectiveness research. And again, when I describe the background of people, we've got a huge variety we've got a really diverse skill set among our faculty, and people work together quite well, but it is a very diverse group. So we do lots of different kinds of research. But really the commonality across all the faculty is everybody's quite strong in terms of research methods. People have areas of content that they tend to focus in, and again, it varies a lot depending on the faculty, so I sort of wrote down my list and people added to it as we went through the week in terms of putting these slides together. So you can see we do everything from health disparities, health insurance, mental health, pharmaceutical policy, trauma outcomes, lots of outcomes kinds of research. So a huge variety of different kinds of topics that people look at. This is one of those terrible slides I told you about. But I told you I'll tell you a secret at the end that'll make it worthwhile. What I asked people to do is just send me a list of the journals that they published in 2012 and so far in 2013. And this is the list that we came up with. It's actually a partial list. And you'll notice, again, to hit on the theme consistently, a very diverse set of places that people publish. There's clinical journals here, there's epi-style journals, there's health policy journals, there's health services research and methods-oriented journals. People do lots of different kinds of things. And one of the interesting things about being in a department like that is that, again, people's background and people's CVs actually look very different depending on where their area of emphasis is as they move forward. But despite the fact that we're a pretty young group, this is a group that has a nice national reputation, and we work nationally quite a lot. So I asked people to send me a list of editorial boards that they're on, and you can see that people are on editorial boards for econometrics, for medical care research and review, prevention, some very good journals. We have lots of people who are doing national academic leadership. So Academy Health is the national organizing committee for health services research, and we have people on the executive committee, on the planning committee, scientific committees for academic journals. So again, very nationally active. Grant reviewers for CMMI, for Veterans Affairs. We have 2 faculty members who are grant reviewers for PCORI, and people have recently stepped off as grant reviewers for NIH and for ARC. And again, lots of leadership also in public health practice. So this is a group that very much casts a national profile. Again, to hit the theme of the day, a very diverse group. These are the funding agencies that are currently funding the faculty in HSMP. And you notice it's not necessarily, there is funding from NIH and from NIA, so the common sort of national grants, but a lot of variety beyond that. There's a whole lot of foundation funding. So again, the Physical Therapy Association, the Robert Wood Johnson Foundation, again, lots of different kinds of funding sources depending on the kind of research that people are doing. And then this is an example of current funded research. These are all projects which are currently ongoing, where HSMP faculty are the principal investigators on. And you can see it hits a huge area of topics. So I sort of grouped these, and this is a partial list again. So I tried to group them into sort of health outcomes, comparative effectiveness kinds of studies, things that were doing health economics and cost effectiveness kinds of studies, and then more health policy kinds of things. So you see the kinds of topics that people are doing, huge variety of different kinds of things. And then I told you I'd tell you a secret if you bore with me through the whole slides. And the secret is that this school is really good in health services research. It's a tremendous strength of this school, although I don't think it's necessarily all that often acknowledged or recognized how good this school and this campus is in health services research. A lot of what Cayenne does, for example, falls under health services research. I emailed Spiro Manson, the director of it, yesterday. I said, Spiro, would you call yourself a health services researcher? And he wrote back and said, yeah, I do, and that's what other people call me too. Then I wrote him back and I said, are there other health services researchers at Cayenne that you'd identify? And he immediately sent me a list with about a dozen names. And sort of his view was they do lots of health services research. I asked Lori Crane, our associate dean, I said, would you call yourself a health services researcher? And her answer was, absolutely, I would. So health services research and the social sciences in general are a tremendous strength of this school that I think is often not widely recognized or not acknowledged in public. And we play a role in this, but there was a bunch of years ago, Michael Jordan, when he was in his heyday, scored 68 points in a game. And they went up to the starting center for the Chicago Bulls. There was a guy named Stacy King and said, well, what do you think about tonight, Stacy? And he said, I'll never forget the night that Michael Jordan and I combined to score 70 points. And in some ways, that's how I feel about, thank you, I appreciate the pity laugh. That's the way I feel about the health services research, that this is a tremendous strength on this campus and particularly in this school. And one of the questions that our faculty have been debating via email this week is, what's our role in this? This is what I wrote. I said the strength of our department is the use of theory and advanced methods for the quantitative analysis of observational data. And I think that sort of hits some of the buzzwords that we tend to focus on in terms of observational data and theory and methods. Other faculty, one of the other faculty members wrote back that she thought a better one would be the systematic application of theory and quantitative empirical methods to the analysis of health policy problems. And as we put things together, one of the words that kept coming up was the idea of applied methods for real policy problems. And so that's what our department is, and I think we're going to see two really terrific examples of this, where we're going to see two studies that use very good methods with observational data to look at two very important policy problems.